Hi, everyone, and thanks for tuning in to this edition of the Lipedema channel. We do inspiring interviews with women who are managing their condition and offering help and hope to others who are on the same journey. And I'm so pleased to introduce you to Gretchen Schackel today. Gretchen, thanks for being here all the way from Portland, Oregon.
Yeah, thanks for having me. It's exciting.
I've heard it is exciting. I heard great things about you. I heard, first of all, you have an amazing sense of humor and you've actually done some stand-up comedy, and you really do need a sense of humor to deal with lipedema, don't you?
You do. I think a sense of humor helps in all challenges, but I think it really helps you get through kind of rougher moments of, especially when you don't have much information, which is where I started. So I think it really helps to just be able to laugh some things off and keep going and not get too mired down. It's challenging. It just helps. And I think it's also, probably the reason I have the good sense of humor. Well, I have a very funny family, but I also think it probably is a coping mechanism, a little bit. I've just kind of developed it to just kind of,
I talked with a woman recently, and she talked about distraction therapy. And I said, what's that? She said, anything that will distract you from the pain of the moment and the problem of the moment is a good thing. And we all have different coping mechanisms, but let's go way back. You say your lipedema started when you were 13. We've heard this a lot. There is a hormonal juncture, whether it's pubescence, that triggers it. Tell me about what you noticed back then when you were 13.
Well, the first thing that I noticed, if I was out on a walk with friends, just walking, at the time lived in a really small town in rural Colorado, and we walked everywhere. At the end of the day, my legs would just ache, and that's all I can say. It's just ache. And it wasn't an ache from exercise. When you have a specific muscle ache. It was all of my legs from, my hips down would just ache. And I would ask my friends, I'd be like, your legs hurt? And they're like, no. I'm like, okay, well, okay. And then it was just very obvious. I mean, I was a chubby kid. I wasn't super overweight. I was made, of course, like all young girls, made to feel like I was, of course, the biggest human alive. But my calves were so much bigger than everyone else's. And, and people would comment about it. And I was 13. I don't know,
Yeah, and nobody knew. And, back when you were 13, you mentioned in the email you sent to me, this is before the internet. So it wasn't like you could.
This was 1983 when I was 13. So, no, there's no internet, no. And this is also rural Western Colorado. There was no advanced doctoring so it was always just well, if I lose weight or work out or whatever, that should take care of it, right?
And you did lose weight. You lost 85 pounds. And what happened?
So when I was 18, 19, I thought, okay, we had moved back to Oregon, and I thought, okay, well, I'll just lose the weight and fresh start. And between high school and art school, I lost 80 pounds and was so thin on top and did not lose weight in my legs. And it was so confusing. And again, people would comment. I remember one time I was walking and my brother was walking behind me, and he was just like, your calves are so out of proportion with the rest of your body. And I couldn't wear boots still. I would wear shorts, but people would make comments. So I just stopped doing that. And again, and I did go to see a doctor because I thought, well, maybe I have a kidney problem or something. I just didn't realize it was fat. I just thought my legs were swollen. And so and they were probably also swollen too. And I had worked at the cannery in the summer, which you just stand all day. and then went to art school, which is also usually standing all day at an easel. So I was standing all the time and my legs would hurt. And I remember I went to a doctor and she was like, I don't know what this is, but she did tell me at the time she had just seen a mother and daughter who had a similar thing. And I was like, oh, that's interesting.
You know, it's always surprising to me that people feel, and of course, this was your brother who made that comment, but that
Oh, yeah.
people would make comments on your body.
All the time, all the time. And, you know, I mean, the world has changed a lot now where people know that it's rude, or some people at least know that it's rude to talk about other people's bodies to them. But that was not the case for me growing up anyway, where, I mean, people just felt, or I remember one time I was working on this was in high school, and I was working downtown. We were like painting the windows for homecoming. And I could see the reflection of the people behind me. And I remember somebody coming up behind me and like pointing at my legs and going like this, like pointing to her partner about how big they were, not realizing I could see her do it.
Oh.
You know, so, and you have all of these little things that build up. And it's, for me, I can't speak for other people, but for me, it's different than someone calling you fat, because they're pointing out like kind of a deformity. I mean, I don't like to use that word, but I do believe it applies. It's a deformity. I mean, for me, especially, I mean, my calves were so big.
Especially since you were so thin on top. And
I have
so,
a tiny, tiny waist when I'm, you know, at a goal weight or whatever. I have a super, super tiny torso and waist.
so, you know, it's hard enough to be a young adult.
Mm-hmm.
And there's all the insecurities of youth anyhow. And then you add that to the mix. But somewhere
Yeah.
in the 90s, the internet came along and you discovered lymphedema, and you said, well, maybe that's what I have. Tell me
I
about
was
that.
sure that's what what I had. Well, I had gone, I mean, you just go and live your life. And for me, I always kept a lot of extra weight on. And I really believe that that was just as camouflage, because people would comment all the time. And so if I was heavy on top, it wasn't so obvious, right, that my calves were so big. And then, you know, and you also, I was starting to develop the pillowing, you know, the little ankle cuffs around your ankles. I have pretty big ankle cuffs, and even after surgery, one of them is much smaller, but one of them I had so much fibrotic tissue, surgeon didn't feel like it was safe to mess with it, so I still have one of them. You know, it's just a thing.
So lymphedema first.
Really thought it was lymphedema. Yeah, I had gone to give blood, and the nurse was like, you need to go to the hospital, because she thought it was congestive heart failure. She thought I had congestive heart failure. And in fact, my first, my long-term boyfriend for 10 years, when he first met me, he thought I had congestive heart failure because my calves were so big. And like, you know, there's no medical anything about it. And it really, more than fat, it just looked like swelling. And so I remember it was around that time we looked it up on the internet. I thought, well, this nurse is so concerned, I know it's not congestive heart failure. And that's when I found lymphedema. And there was actually even some kind of medical clinic in Seattle that was treating lymphedema with compression at the time. But it was just out, you know, a young artist in her early 20s, like completely out of reach for me. No, I didn't have health insurance then.
Wow.
So there was no like, oh, I'm going to go try this thing out and see a specialist or anything. And, you know, usually anything that you try, you feel so defeated because it doesn't help, right? Weight loss doesn't help. Exercise doesn't help. You know, I would do all those calf exercises. I used to stand on the edge of the tub and like, you know, do those calf exercises where you go up and down on your calves, and didn't do anything. So yeah, it's just very frustrated about.
I'm hopeful that through the education and the advances that have been made in the recent 5 to 10 years, that there won't be other
which,
young girls out there who are age 13 and waiting until their 40s to get a diagnosis.
right. Right. Yeah, I hope so too. And, sometimes you'll just be walking down the street and you see someone and you're like, oh, I know what that is. And I think a lot of women with lipedema have had this experience where you're like, I'm going to help them. I'm going to, approach them and say, hey, I noticed blah, blah, blah. And I just want to let you know that that it's this. Never goes well. Anyone that I've talked to, honestly, is like, yeah, it's never well received. But you feel bad because you want to help them. And if they are suffering in the same way, you want to help educate them. So it's so challenging.
And it's not about
I've done it. It's
but
never been well received.
Weight is such a button for people. I mean, my own mother can't talk to me about weight because I see all the shades of the rainbow. I'm like, just don't go there, right?
Well, and it's really not polite to talk to other people about their bodies, even if you think you are helping them and you have information for them that you want to like spread the good news, right? You just want to be like, hey, I found this information and it really helped me. And of course there's no cure and they don't know what causes it still. So there's still that like level of frustration of like, I don't know what's wrong with me.
Yeah.
Or why. But to just have knowledge and to really to meet other people that have it has been the most helpful thing for me.
Yeah. Well, let's get to first your next step. After thinking perhaps it was lymphedema, you did have manual lymph drainage and you started wearing compression stockings. Did it help?
Yeah, it helped a little. Because I really, at that point, I was very heavy. I was probably at the highest weight that I had had. Again, that kind of camouflage. I was probably, I want to say maybe 34, 35. And had insurance. And so that would cover it. And so and the reason that was covered and that there was any treatment, there was a breast cancer clinic where they were treating lymphedema patients. So I would go to the cancer clinic every morning. I did this for 3 weeks and they would do the lymph drainage massage and then wrap my legs. And I did it in July, which I don't recommend. Because they were really, I just called them my oven, they were like oven mitts. It was just like wearing oven mitts on your legs, really tight oven mitts for 3 weeks, going every morning to have them. My boyfriend at the time would have to put them on weekends and holidays. I very clearly remember doing it on the 4th of July when he had to do it. It was not fun because they're all the way from your toes to your hips. We're just wrapped in, that like in an ace bandage. Well, first they put the styrofoam on and then wrap it with an ace bandage. And then I wore, those little shoes that you wear when you have a cast. I wore those little shoes and I went to work every day. I would get up, go to the hospital, get wrapped, go to work, have to explain to people what's happening. My parents would come up once a week and take me grocery shopping and I would have to like ride around in the little carts. Aww. Which, and that's where having a sense of humor helped. And like, my dad is also very funny and just like, we would just laugh about it, just like, here I am. And I remember even like running into like my art school teacher and being like, I don't want to be seen. Like, I hope she doesn't see me because I can't explain this. I can't explain what's happening to me right now.
Yeah.
But you just had to laugh because it was so ridiculous, and it did help. And then I started wearing compression stockings every day, and stopped taking baths because I thought taking a bath would just make my legs swell.
Wow, this is
only shower, and I live for taking a bath. So I didn't take a bath for a year. I would just only shower. because I thought being in the heat for so long would make my legs swell and undo all of the good that had been done.
And this is what I hear all the time. Women or men, largely women who have lipedema, will do anything so it doesn't get worse.
Anything so it doesn't get worse. Yeah. The second that I would wake up, I would put my compression stockings on and I wouldn't take them off until I went to bed.
So then you had a breakthrough. You began learning about lipedema and you would Google it on occasion. And then this one time you Googled it, you had an aha moment. What was that aha moment?
Well, I mean, there's the time when you Googled it when you're like, oh, I really think this is what I have, because they had the like diagrams of people's legs. And I'm like, those are my legs. Those are exactly my legs. I've never seen anything before that looked exactly like my legs. And I'm like, oh, that's absolutely what I have. You know, I'm like, called my mom and was like, hey, what do you think? You know, I think I have this thing. And you could email her the link and she could look and be like, oh yeah, that's absolutely it. That's what you have.
Yeah.
So that was the first time. And it was a great relief. I mean, it was frustrating because you're like, oh, that treatment that I had was not sufficient. The cure, right? It wasn't sufficient. But at least like I knew what it was. It's always so frustrating to find out more information because then it would always say there is no treatment. You're like, oh, great. Okay. You know, what do I do? Like, knowledge is power, but when there's no treatment, there's a lot of like getting hopeful and then getting your hopes dashed and then getting hopeful again and then getting your hopes dashed. I mean, just a constant cycle of that over the years.
So you found a doctor who actually knew what lipedema was, and he was going to be at a conference for which you registered immediately. What was that conference?
It was the first real lipedema conference in Tucson. And that was 8 years ago. And I remember asking my mom, I'm like, do you think I should go to this thing? And she's like, it's really the only thing you have. And if it turns out to be a disaster, it's only 3 days. You know, you only have to get through 3 days of it. I'm like, okay, well, I'm going to go to this thing. Whatever it is, I'm going to go. I've never been to Tucson before, you know. And it was really, for me, it was a miracle. It really changed my whole entire life forever. Absolutely. Hands down. I was in a room with 60 other women who had the same thing as me. And for me, it was like your whole life, you speak a language that no one else speaks. And then you're suddenly in a room with everyone who speaks the same language. And we were all just like comparing stories and photos and pictures and experiences. And it was the first time I realized that I did not cause this, because I had just assumed that I had done something in my life, like made a lifestyle choice or something, you know, that caused this, and that it was my fault somehow, or that if I had done something differently, maybe it wouldn't have been so bad, or like any of that. And just talking to these women who all had very similar stories as mine, that I was just really able to let that go, that this is not my fault. Having this chronic illness is not my fault. It's genetic. Like, there were moms and daughters there who were like, yes, this is genetic. And, you know, there were women who had shown me photos of them where they, you know, it said I was positively anorexic in this photo, and they were skeletal thin from, you know, the waist up, from the hips up, and then their legs were still what I would consider thin, but still had like the ankle cuffs and had, you know, they were fat. There's fat there. And it just blew my mind, you know?
You were validated. You knew you weren't alone. And I love this aspect of it. You said we swam and played without shame.
Without shame. I remember getting ready to go to the first dinner and was like trying to pick out what I was going to wear. And it was the first time I realized how often I think about how to camouflage my legs. Cause I was like, oh, I can wear whatever I want. If I wanted to even show my legs, I could. Cause I would never, ever, ever, ever show my legs. Ever, ever, ever. Wide leg pants. You just scour the internet for them, scour the stores for them, you know, anything that would disguise my legs. That's how I dress. That's what clothes I chose. And I was like, oh, I don't even have to think about that at all. And just like even realizing how often I did think about that unconsciously, how much this disease, which I didn't think really affected my life that much, you know, how it affected every single choice that I made. It never really, I never knew that. And then, you know, to be in a pool with other women who had very similar experiences, always camouflaging their legs, would never ever show their legs in public. But swimming is, and the irony is swimming is one of the best things for us, right? So here we all are in a pool doing a thing that we love to do and is like the healthiest thing for us, but we can't do because of the comments that people will make. Just swimming and having a good time, no judgment. Just being able to feel a sense of normalcy that you didn't even realize you weren't experiencing because you just pushed it so far. I mean, I had pushed it so far back in my head, you know.
It's an amazing experience, and it led to yet another experience because you encountered or learned about a doctor. Tell us.
I learned about a doctor. At that conference, there was a woman who had gone had surgery. Maybe there were two different women there. Well, they had both seen Dr. Stutz in Germany and had high praise for this person. And like we had always been, everything you had read up until that point on the internet was that you could not have liposuction, that it would damage your legs beyond repair. And there were women there who had had botched surgeries. You know, there were some real horror stories actually of women who had had botched surgeries from surgeons who just went in because your lymphatics are so fragile, and liposuction is very violent when it's done in the US. I don't know that people necessarily realize that, how not cautious and just super violent it is. I mean, you're putting in a suction hose and just, you know, sucking fat out of someone. And so they were like, yeah, we'd been to Germany and we had liposuction with a surgeon who has been doing this for 19 years and it's highly specialized. And Dr. Herbst was also at this conference. And so she talked about lymph sparing liposuction. And I mean, there were a lot of us there that signed up immediately. And again, like it was not covered by insurance at all for anyone. And I was like, well, I think the price tag was about $20,000. I'm like, oh, I don't have $20,000, you know, sitting around. So I didn't think it was even possible for me. And then a friend of mine was like, well, why don't you try fundraising? And because I work in philanthropy, I'm like, oh, maybe I could do that. So yeah, I raised $20,000 and went to Germany for this surgery.
So you're quite an adventurer because you went to the Arizona conference, not knowing anyone, not knowing anything. Now you go to Germany all by yourself.
Yeah, I had a cousin that was supposed to come with me, but she ended up not being able to go. And I raised the money, booked the surgery, like I was going. And one of the women that I had met at this conference, she was also going to be there at the same time. So I knew I wasn't going to be totally alone. But like, I think 10 days before I left, I had to rebook everything, like where I was going to stay, what my plans were. I had to rebook everything.
So was the expectation? What was your expectation going into the surgery?
Oh, I had some pretty high hopes that did not necessarily become realized. Because again, you know, you're communicating with a surgeon in another country, going to have a surgery that not many US women, there had not been very many women, you know, we were all, in my opinion, pioneers, like, and kind of, that's how desperate you are for treatment, that you will do anything. And I do just see us all as very pioneering women that went to see Dr. Stutz in Badstaben. I really thought I'd be in boots again. I thought I would be able to wear boots, and that is not what happened, because Dr. Stutz does not do the surgery for cosmetic reasons. His main goals for the surgery are to correct your gait, because I walked like this. Because I have so much fat above my knees. Most of my, I mean, not only, you know, it's a progressive disease. So not only were my calves really heavy, but I really walked like this. Just had so much fat around my knees that I could not do this, you know? So goals were to correct your gaits and also to stop the progression. It's not a cosmetic surgery. So I kind of went there thinking, you know, I would have the surgery and then, you know, lose a little weight, and then I would have kind of normalish legs. And but it did remove some fat from above my knees. And that's really where he decided to focus on the most. You know, you go there, you don't know really what he's going to do. You've never been seen by a doctor who knew what it was before. I did see Dr. Herbst about 3 months before I left. And I think some women who went to see him were disappointed because it did not end up being cosmetic surgery, you know, and their legs still, you have these hopes that your legs are going to be normal. And that is not how he treats it.
And yet you say you have no regrets about having the surgery.
Absolutely no regrets, because I used to walk like this and now I don't.
So in itself, your mobility was improved.
I would have, because I had so much fat right above my knees, I absolutely would have had to have knee replacement surgery. And I don't think they would have given it to me because I had so much fat above my knees. So maybe I would have lost. I mean, I'm going to be 51 in 2 months. So it's very possible that I would have lost a knee. I had already had a kneecap go out of place in my 30s. It did finally go back into place. And, you know, trying to get physical therapy, like the physical therapist didn't even want to treat me because my legs were so heavy and they didn't think there was anything that they could really do when my kneecap went out of place. So I mean, there were times where I was really looking at some real dire consequences about, because I've had it since I was 13.
Yeah.
You know, and very much have my whole life expected myself to do everything that anybody else could do. And I still to this day feel the pressure around me to be able to do physically everything else that someone my age can do, like go hiking, go blah, 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 you know, cycling, be able to keep up with anybody, you know, on a walk, when that's not really realistic. I have a leg condition. Like I still have lipedema. It hasn't gotten any worse since that surgery. And that was 6 years ago, almost 7.
That's a great outcome.
That's a great outcome. That's a great outcome. So my legs don't look like everybody else's. Okay. Like I've really come to accept that. Like I'll show my legs now. I mean, one thing that changed after that conference, I stopped wearing pants. That I was just done with pants. It was dresses and leggings from then on out. Cause it's like, well, if anybody says anything, I can be like, listen, I have a disorder, so maybe you should shut up. And I just realized like how ridiculous it is to try to put my body into something that was not made for my body. I can't wear jeans, skinny leg jeans. Are you kidding? Nobody makes pants. And I don't know if anyone's talked about this. Nobody makes pants for people with lipedema. No one. Everything is a tapered leg. Like my whole life, I've been trying to shove my legs into like some kind of tapered leg. So you wear pants that are like way too loose at the top, just so you can cram your legs into them. So I stopped doing that immediately after that conference. I'm like, I just put on some leggings and a dress. And that was really my outfit for many years. And now, because jumpsuits are kind of in fashion and they make them wide legged, like right now I'm wearing a jumpsuit with a wide leg, and my ankles show. And so people can see my ankle cuffs. I don't care.
So it feels like, aside from the physical improvement after the surgery and after that conference, there was a mental improvement and a decision to accept yourself.
To accept yourself. Yeah. I think because I had a name for it and I could tell people, listen, I have done everything I can possibly do to make this easier for myself. And, there's no treatment. And like, I'm 51. I'm not going to hide anymore. And I think the body positivity movement really has helped me as well, where people are honest about women have this expectation that we're supposed to look like, and even at 50, like at 51, things change,
By the way, and this is a known marker, women with lipedema look younger than
I watched your YouTube video where you guys talked about that. I'm like, so that's what it is. Because I don't look my age. I never have. I'm nary a wrinkle.
No, I know.
I'm like, starting to get some wrinkles. And I'm like, wait, what is this? That I made a deal, no wrinkles.
Well, there you go. So I have to ask you, how does your lipedema parlay into your humor? And when you do your occasional stand-ups, what's your shtick?
My shtick? A lot of my shtick is just like being a single cat lady, and just, the trials and tribulations of just my life. That's a lot of it. And just, I'm a very observational humor. I have many stories about my life, but I would never tell a joke about my body, because then I feel like that's inviting other people to joke about my body. And
Good
this
point.
Has been very true my whole life. I can talk about it. And maybe another human who doesn't have it can talk about it with me, but Lord help you if I found out that you've talked about my legs without me being there. Like that makes me very angry. And I'm sure that people have made like, oh, I think, if she just did such and such, or what's wrong with Gretchen, or her legs are so big, or whatever. Like if I were to find out that anyone had done that, I would just be so, so angry. And I'm sure that has happened. It's a very sensitive subject for me outside of women who have it, because I'm very angry. There's a part of me that's still like so angry in that, and still in my everyday life, and the people in my life sometimes, because there still is that expectation of me. Like if I can't keep up when people are walking, or I can't sit in a certain chair, or if I'm getting together with my family and someone takes the seat with the footstool and leaves me to sit somewhere that is not comfortable for me, like I may not say anything, but inside I am seething. It's just like, do you not see me? Still after everything that I've been through, do you not see me? I don't. Or the other thing that really, really will set me off, if anybody who does not have lipedema makes some comment about how they don't like their legs in front of me, don't do that. that is so, in some ways it makes me happy. I'm like, well, obviously it's not an issue for them, because they wouldn't say that in front of me if they recognize that my legs are not normal. I mean, because my left leg in particular is still, in my mind, kind of a deformity. And it has affected every aspect of my life. I mean, I think that's probably why I'm still single. Like, in my head, I still feel like I am completely unleveled. Like, someone is really going to have to settle to be in a relationship with me. Because, and anytime that I've had a relationship that has come apart and then they end up with someone with normal legs, it just cuts my heart right out. Because I always assume that's why.
Okay, so
never been a time I haven't assumed that.
I can't thank you enough for your candor, because you've exposed some things that we can all learn from in this, and things that we need to be empathetic, sensitive to, and understand better. But I have to say, just in my brief time talking with you, just how worthy of love.
Oh, sure.
You are. And
sure.
I understand we all have mental battles.
Yeah.
We all have some. I always say this in every interview. We all have something. We all have something that is our deep, dark torment, you know?
Yes. Elaine Stritch says we all have, everybody carries a bag of rocks.
Yeah.
This is my bag of rocks to carry around. And like, how can I not feel that way after everything that I've been through and all that? Here comes June. You just carry
we
it
were
on.
hoping that the cat would make a cameo.
There's not been a Zoom call that I've been on, if I've been home, that she's not made a very distinct appearance. But I mean, how can you not feel that way about yourself when I've been told that to my face?
Wait a minute. I mean, I was a girl. Okay, so I'm going to just push back just a little bit, because when I was in high school, the mean girls decided I didn't deserve to be in their company, and they would bark when I walked down the hall. And I, for years, fought that, am I bark worthy? Am I a person that is so grotesque that someone should bark at me? So I do get that. They want to lodge in there.
I did not realize that other women, this was something that I really didn't realize until like maybe even the last 3 years. No woman is happy with her body, and how sad that is. I mean, when I was in high school, the guys in high school would moo when I walked down the hall. I mean, if we were all to really, and I think it's not unique to women with lipedema. I always thought that it was, you know, but to hear you say that and know the things that
we all have painful memories, and other people have imposed their judgments on us.
People have said to us. And when you have lipedema, it's just magnified, because like I said, I really thought it was just specific to me.
Yeah.
Not because women, we didn't talk about this. We never talked about the things that people would say to us.
Yeah. I think it's great to expose it, to get it out there.
Absolutely.
In the light of day, anybody would look at you or look at me and say, what? Come on. But you said something about being age 50, and I think something happened in my life at age 50 too, which was sort of like, I embraced, Byron Katie says, it's not your job to like me, it's mine.
My job.
Yeah.
My job.
And once you make that shift and really start to like yourself, it starts to attract so many better things in life.
Oh, absolutely. And I think that's part of why I'm never going to wear pants again, like try to shove my legs into a pair of jeans. I like myself too much to put myself through. I mean, if you were to talk to any, and again, this is a thing that I thought was really just specific to women with lipedema, but then in talking with other women, it's like, no, we all go through this. Just trying to find pants that fit any human woman body is something we all struggle with.
And bathing suits? Come on.
Yeah. I mean, and I really like, it's just been, and I think because in just openly talking about it with other people, and I'm very fortunate. I have found in the last couple of years a group of women friends. We were all members of a kind of like a membership club, like a social club for women. That the social club kind of dissolved, but the group of women friends have all stayed together. And it is a group of women who are very body positive, very like women support women. And I mean, they really, because I've seen the exact I've been in situations where women will drag you down the second that you try to find happiness. Like, you know, that's been just really good for me. Like, I'm friends with the women that I met at that conference still to this day. Like, we're friends on Facebook. Like, maybe we don't talk all the time. I saw Paula last October. It was just so great to see. Like, I'll always be friends with these women.
Yeah.
It was such a significant time in my life to just not feel like I have to explain myself or be like, you just the whole gamut of experience. But it's really that self-acceptance thing that you have to get to, however it is that you get there. I've never found a therapist that has really done that for me, but I have had experiences with other people that have really helped. And I do think, you know, the comedy, like improv and being on stage, and there's just been a time in my 40s. I basically got divorced at 41. I was never married to this man, but we were together for 9 years. And so like my 40s were like what my 20s would have been. I was such a shy hermit of a person who thought I was unlovable, too fat, weird legs, because my legs were just huge, you know? I did not have a typical 20-year-old experience at all, because I really just didn't like myself. And a lot of that was because of my legs. And you push that out of your mind. But when I saw Dr. Stutz in Germany, you know, they put you in front of the screen that has like a grid, and they mark you like what he's going to do and what the fat he's going to remove. And he said to me, I wish I had met you when you were 14, because your life would have been very different. And that's the other thing for me, the grief. I mean, it's a grief experience. Yeah. Because you have to mourn the life that you think you would have had if you had not had this disorder, disease. I'm not sure what we're calling it now. You really have to, when I came back from Germany, my whole life had changed radically. That experience in Germany, because you're there, I was there, I was gone for 6 weeks. I wasn't working. I didn't think about work ever, other than like, oh yes, I do have a job. And my mom did come for a week. We went to Amsterdam together, because there was like kind of a break between when the surgeries happened. So I did see my mom, which was great. But I was in a town, I didn't speak German. And where we were in Germany, they did not speak English. If they had a second language, it was most likely to be Russian. So I think God, and the people who ran the apartment that I was in are angels in my mind, because they did speak English and they took such great care of me. Like, I love them in a way that I cannot explain. Truly magical. Like, you want to talk about miracles, like that, ending up there by yourself with people who are so loving and took such good care of me. But I found myself there. You know, I remember I took many, you know, because hi June, it's no help from you, thank you. mean, you're really just surviving on your wits sometimes. And, you know, you're taking the train, and the train, they don't make the announcements in English for most of the train rides that I was on. And like when the conductor comes to tell people things, like if there's a change in the train route, like that also is not conveyed to you in English. So you have no idea what's going on. So you're just really just so far away from everything and expectations, and you're having this very strange experience. I remember being on a train on the way to Frankfurt to go meet my mom in Amsterdam. And I'm like, remember thinking to myself, this is me. Like, this is who I really am at my like core. Like, nobody can take this away from me. Like, I have found myself. Like my actual self. Like, I remember thinking about that.
Yeah. Well,
the problem with that was I had changed radically on this trip. And because also, like, again, you know, we went to see Dr. Stutz for, I can't remember the name of the treatment that they do on your legs after you have the surgery. It's kind of like vacuumy, massagey thing. I can't remember the name of it, but you know, we were there all the time. So you're in the land where people speak lipedema all the time. And he had an American surgeon that was there, who's, I'm so terrible with names. He lives in Delaware. Anyway, he was there training with him when I was there. And so, you know, I would talk to them, and I remember like being in their office and them showing me all of this information, you know, about like the mesh web that our fat cells are caught in. And like, I was just like, you're in this magical land where you're understood.
Yeah.
You know, for 6 weeks. And so when I came home, I had changed, but the circumstances of my life had not changed. Like, same apartment, same job. And I was very unhappy in my job at the time. And you would talk about mean girls. I mean, I came back and my boss and my coworker were terrible to me, because they are people who cannot be happy for you, for anyone who has something nice happen to them. Like, that's not, you know, that's not who they are. I probably fell into the worst depression I've ever had when I came home, because I had this miracle happen, and then it felt, in a way, kind of taken away.
Like a letdown. So how did you?
It wasn't a letdown. It was that the circumstances, like, you change when, like, you remove one crayon from the box, all the other crayons move around, right? And so you huge change in your life. You've changed, but the people around you don't know it yet, right? Everything is shifting. And so when I came back, there were just some things that I was not going to tolerate anymore, you know, where I had really found myself, you know, but I couldn't. The recovery time from the surgery is a year. I wanted desperately to leave that job, but I was not in financial, and also I raised $20,000, but I also used my own life savings to have this surgery. So I was broke because I had given it all up for this. Again, no regrets, was totally worth it. I'm a single supporter of myself. I could not leave that job. And I was in a position where people were honestly quite cruel to me, and not able to leave.
Yeah. And so look at you today. How did you get to where you are today? Because we're running out of time, and I want to leave everybody with a message from you for someone who maybe is at that moment where they are depressed.
Well, yeah, because Dr. Stutz had told us, you know, a lot of people come home and break up with the people that they're with there, because they're new. And you really have to accept, I think, that not everybody is able to come along with you on your journey. And you really, and it took a long time for me to, I mean, I just left that job a year and a half ago. I mean, it took a really long time to get out. You have to be willing to walk away from things that don't serve you. And that's been the hardest lesson for me to learn, is to be able to say, no, I'm not going to do this.
I know people are going to want
it's okay to walk away.
Follow you. How do people follow you and find you on social media?
Well, have a website, GretchenSchackel.com. That's my artist, because I'm a comedian, but I'm also a painter. I mean, that's what I do. So you can follow me there. Schackel Studios is my artist Instagram handle, and also my Twitter.
You've been delightful and wonderful. Are there any final words that you'd like to share with our audience?
Oh, I really just never give up. Because you don't, that thing now that's so amazing to me, you know, I went to that conference 7 years ago. It was just 60 women. And a disease that nobody talked about, and no other, there was no YouTube video with women talking about this disease. And I also really caution people to use their discernment about what kind of information they are going to get. There are so many more people now in the US that are doing surgeries, and I'm sure people have had success with them. I haven't followed up so much with all the new information, but part of the reason why I'm happy that I saw Dr. Stutz, he has 19 years of experience with this surgery. I think because we're so desperate, it's so easy to be taken in by someone who might take advantage of you, or, you know, like, or even they'll have like diet information, or, I mean, women who have weight issues or body image issues, I mean, we are preyed upon because it's a money-making thing. So that's my other advice, is really do your research. Really, really, really do your research. And don't just, even if someone, I mean, there are people that I know who have run some scams in the lipedema community. So you really, really have to be cautious not to get taken advantage of. I mean, I hate to say that, but that's the other piece of advice.
So that goes right along with the sense of, I'll do anything to not get worse, and I want to do anything to get better, and people will prey on that. That is really wise and good advice. Gretchen, you have been a fascinating interview. I had originally thought we'd talk for 15 minutes and I couldn't stop. So thank you. Thank you for helping encourage the lipedema community. And by the way, do you have lymphedema as well? Did you determine if you do?
Oh yeah, I still have swelling. Yeah, okay. It's a combo. So, but I have to say, after the surgery, once that kind of year period has gone by, I don't wear compression stockings every day. Maybe I should, you know. I'll only wear them if I notice that I'm really, really swollen. But one thing I've noticed is that stress makes my legs swell. And I think we'd love to talk to Dr. Herbst about this someday. If there is a stress component to this disease that makes it worse, just having, like, maybe it's that cortisol release in the body, or because when I was at this job that I didn't like very much, it was actually super stressful, but I had a sabbatical. So I was gone for 6 weeks, and I was in my studio painting for most of that time. So I was doing all the same kind of behaviors that I thought led to swelling. All my swelling went away.
Interesting. That's an interesting observation. Wow.
Yeah. I didn't have any issue with swelling.
Wow. So that's interesting. And there is much research and many advances being made. And we are so grateful for people like Dr. Herbst.
Yes, Dr. Herbst is incredible. She is incredible. So grateful for her.
Yeah.
And, you know, in talking to people that you trust, like I love talking to Paula because she's up to date on everything all the time.
She attends all of our roundtables, and she's the one that introduced me to you. So I'm so grateful for that. We thank you, Paula. And I got to bounce. We're out of time.
Yeah. Okay, well,
so thank you everybody for tuning in. Thank you, Gretchen. If you know of someone that would make an inspiring lipedema interview, send them my way. bviola@medsoulsupplier.com. Have a great day. See ya, Gretchen.